CNA Practice Test 2025 Safety and Emergency Procedures NEW 40 Questions Answers. Question 1. The normal adult pulse rate is 40-60 bpm, 60-100 bpm, 100-120 bpm, 50-90 bpm. 60-100 bpm is the normal range. Question 2. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the one way to prevent infection spread. Question 3. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 4. A resident refuses a bath. You should force them, respect their refusal and report it. Call their family, tell them they smell. Residents have the right to refuse treatment. Question 5. Post-mortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 6. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 7. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent bacloslash-infection. Question 8. How should you identify a resident? Ask their roommate, check their room number, check their ID band, call them by name. ID band is the standard identifier. Question 9. When dressing a resident with weakness on one side, dress weak side first, dress strong side first, dress both at once. It doesn't matter. Dress weak DBW, and dress strong. Question 10. Which position is best for resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 11. When feeding a resident, you should rush them, offer small bites and wait, use a straw for everything, talk to other staff. Prevents choking and promotes dignity. Question 12. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 13. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 14. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 15. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 16. A resident is in isolation. What is done with their linens? Double bag them, wash in the sink, throw them away, shake them out. Double bagging or special handling per facility policy. Question 17. What is the first step when discovering a fire? Rescue residents. Activate alarm. Contain fire. Extinguish. Race protocol starts with rescue. Question 18. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 19. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances. Question 20. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts Heimlich for complete obstruction.